Welcome to Patient. I'm Mary Elizabeth Williams, and I'm so thrilled because this is my oldest friend in the world. Among other things, this is Rose Reyes. She is also a concierge. She is an academic. She is a poet and a writer, and just a woman who literally I have seen wear many hats. And she lives in Paris, France, the dream of everyone, not just Emily. And we're going to talk today to Rose about your experiences in different healthcare systems. First of all, hello, my dear.
Hey, how are you?
Okay, I want to start with the question that I think is really the heart of this whole series. Rose, what was the healthcare experience that radicalized you?
Oh, geez. I would have to say the turning point for me was first of all, just being a woman in the healthcare system. And the turning point for me was struggling with tumors in my uterus, fibroid tumors that had turned precancerous. And the trajectory to treat this as a woman that started with this dilemma in my mid 30s to my early 40s, that's what radicalized me. And I realized that I was getting subpar care in the United States, that I was treated differently and often not believed about my symptoms. The fact that when I did finally get the correct health care going through the system, having had insurance all that time, the way that our insurance was structured and is still structured privately was a disaster for me to navigate all of that while being sick, because that's the thing. You have to deal with all of the insurance issues and the approvals and the disapprovals, all while you're ill and trying to make good decisions. So I think that's what radicalized me. I remember this moment in particular where I was post-surgery. I had had a myomectomy at Beth Israel. And I had finally found, after 4 or 5 tries, the best OBGYN in New York. And I miss her even today. I would pay out of pocket to see this woman if I ever go back to New York. And she did this surgery for me. She solved my latest issue, which turned out to be the last time I had to have major surgery and tumor removal. And she basically saved my reproductive system because she, nonchalantly said to me, you could start, if you wanted to get pregnant, you can start 6 months from now. You'll be good to go. And this was the first time someone ever gave me any kind of hope. But the experience of having surgery and the recovery and the insurance was a nightmare. I literally had to pay my deductible as I was being rolled into the OR. I was basically prepped and masked and on a gurney. And they were like, oh, we forgot to charge your deductible. That'll be $2,000, please. And I was like, I know I brought my Amex somewhere. It
It
was
might not be
basically,
in this hospital gown.
it may not be, yes, because my stuff is in a locker. But if someone could get that for me, I would very gladly pay this deductible so we could get this thing rolling. Having no space in the OBGYN section of Beth Israel, I was put for the nights that I was going to stay post-op in the psych ward. So that in itself was another experience. I think I remember sharing a room with someone who was completely off kilter and having a night security guard posted at our door because she was so unstable. Needless to say, that was the worst night of my life. And the next morning, I begged my doctor to let me go early because I couldn't stay in a psych ward, not for an OBGYN procedure. I mean, hello. And I remember as I was crying my eyes out that night, I was like, this is the worst medical experience I've ever had. And if I could go live somewhere where, this is a non-issue, or it could be better, you know, I would do it. I would do it in a second. And I think from that point on, I started thinking, plotting my escape,
Scheming. Two things,
scheming.
and making it work. Two things about that.
Mm.
First, we know that health outcomes are also worse for women of color. Did you feel
Absolutely.
that was also a factor in the way that you were
Absolutely.
treated?
Absolutely. When I said that I went to 4 or 5 different doctors, I was looking for second, third, fourth, fifth opinions. It didn't have to even go that far. But the fact of the matter was that every doctor that I consulted treated me in a very negligent way, whether they knew it or not. They probably thought they were being very professional. There was the male GYN who was very matter of fact and said, "What you need is a hysterectomy." Even though I was fairly still in childbearing age and wanting to do that, he was like, I think it's just a waste of time to keep doing what you're doing. Just let's take it all out. And this was while he was examining me. You're in a very vulnerable position. And luckily, I think many states have this law, but in New York, if you're being examined by an OBGYN who's a male, you need to have a female in the room with you. And I remember looking at her and she just kind of looked at me and shook her head like, I know I can't be responsible for his bedside manner. Then there was the other gynecologist, the other OBGYN who was a woman, a young, very vibrant, dynamic Asian woman who basically sat me down and said, "You know what you should have is a hysterectomy. You don't want kids." And she pointed to the family photograph on her desk of her and her 2 kids. It's just so hard. You don't want that. In fact, your uterus is so small, I could probably do it vaginally. It'll be like quick procedure. You'll recover in a few weeks. You'll be fine, and this will be behind you. And, I think what struck me that day was like, here's a woman telling another woman, you don't need this stuff that you're born with. It's like it's kind of useless. It's causing you some trouble. You don't want to have kids. It's just so much trouble. I left that office. I was mortified. I was like, wow. And I think when I did find my champion doctor, the first thing she said to me was, "We can save your reproductive system should you want to go that route."
That's amazing. That's different. That's
Yeah,
very,
it was very refreshing. She's like, "You have a propensity for this. You've struggled with this for the last 7 years, but if you want to try and save your reproductive system, I can make it happen."
wow.
And she
The
did.
And she did. We're going to move to France in a little bit, but I want to, before we leave the US, I think that the argument that a lot of people in the US have, whether they know it or not, is yes, our system is expensive. Yes, it costs too much. Yes, it is extremely privileged, but we're paying for the best care in the world. We're getting the best.
I
You
wanted, yeah.
you are telling a different story about that expectation.
Yeah, the expectation for me was I was an independent worker at the time, and I was paying Blue Cross Blue Shield close to $650 per month, okay, as an independent freelance worker. And I thought that 650 would buy me something. I certainly didn't count on compassion, but I definitely thought that money would buy me something.
Competence?
Um, Competence, you know, patient advocacy. Yeah, certainly not compassion, but definitely I thought, well, I need competence here because I've been struggling with these issues for a long time. It basically like colored my life from 35 to 41. And those are great years to be alive as a woman normally. But I did notice I was treated differently because I was a woman of color. My first OBGYN was a white woman who at one point, when I was very uncomfortable while she was examining me, blurted out, "You need to relax. Have you even had sex in your life?" It was really, really like so condescending sometimes. you know. And I think also a lot of, a lot of the male doctors, had that I had been with, with these problems had said to me, we think all these, are you sure this is happening to you? Like as if it were something that was made up. And I'm like, no, you need to listen. And I've gotten really, at that point, I gotten really great at reading upside down. And I would see my chart on their desk or, in their hands. And I was always first described as a Hispanic, pleasant, I saw that a few times, overweight woman. And I think this is something that also the medical industry discriminates against in the United States. As soon as they see a person of color, maybe they're overweight, the competence level just dumbs down. Like as if I don't really need to spend that much time with this person. Do I? Yeah.
Yeah.
So
Yeah.
yeah, all of those experiences really, really like the culmination of all of that, what it spelled out to me is like, get out.
Yeah. Get out. And you did.
And I did. I did.
When I have had my own experiences in the French healthcare system, it is like night and day to what we experience here.
Yeah.
For those who don't know, what do you spend on healthcare a year?
Probably spend all told less than 1,000 a year
Out of pocket?
out of pocket. And included in that amount is a private insurance to supplement my national insurance here in France.
And
You know,
what does that buy you? What does that get you?
well, 1,000 a year will address some of my co-pays. For example, when I go see my primary and I do that once every 6 months, I'll see her and I'll pay her my copay, which is a grand total of €7.50.
You're killing me.
Uh-huh. And my national insurance in France picks up the rest of the tab, which is about 80% of her fees. And then what is left over after my copay is picked up by my private insurance, for which I have coverage for myself and my husband and my daughter for the grand total of €149 per month.
Yeah. No,
Yeah.
it's crazy. Now, here's the thing. People say, right, but you probably have to wait a year to get a doctor's appointment, or you're getting subpar care, or you're in these depressing, grimy facilities. There's a lot of this
But
expectation that like you get what you pay for.
yes,
You tell
yeah.
me.
I thought that too. I mean, I realized that national health care is something that is like a foreign concept in the United States. And with that foreign concept comes all of these preconceived notions. And my thought coming into the system was all of that. It must be old facilities, it must be old equipment, it must be incompetent doctors that were not trained by American medical schools, et cetera, et cetera.
Rose,
What I found
it's
out,
like when we used to get our haircuts done at the from the trainees. Yeah.
yes, or when you go to NYU Dental and you're going because it's cheap and you can't afford a regular dentist.
Can't afford
You
the real
just
care,
I can't
right?
you can't afford real care, so you'll take one in training because that's your lot in life. But here in France, what I discovered, all of my preconceptions were fairly wrong. The only time that you have to wait a long time for an appointment is if you dare take an appointment during the summer, because that's when French people take vacations, especially July and August. You can't find a doctor that would be willing to see you in August, and you must know that in advance. And so you arrange yourself otherwise. But, when I want to see my doctor, I call, I make an appointment. The most I've ever waited was a week to see her. I've described my scenario with what I pay her. She gives me a prescription for my daily meds, whatever they are, and I have that for 6 months, and if I have to renew it and I'm not able to see her and everything is, status quo, she'll write a script that I can pick up in her office.
Do
She'll write
you
a vacation script if I have to go away for 2 months.
do you
And
feel that the attitude towards you as a woman of color, as a woman who occupies a particular size, is different in France?
it is different. It's less condescending, but it's more pointed. The attitude is very spare, you know, as far as being overweight, do they mention it? Yes, but it's very direct, and it's in the context of, this would improve if that would improve. It's not, kind of like discreet condescendence that I received in the United States. As far as color, I think we have so much diversity here. There are some times when I wonder if there's something going on in a very discreet way, but I've never had any outward expression of, like, well, your people are different. There's never been. There is the funny story though. My first primary doctor, and of course I quickly replaced him, was a gentleman. And when I came here for my grad studies, he was someone who took the school's insurance kind of thing, like I had extra insurance via the school. And he said to me as I was sitting in his office one dark January day, he says, you seemed very fatigued, and I said, I am. I mean, I'm definitely going through, the winter blues. And he's like, well, I see from your family history that your family is Caribbean. And I would venture to say that that you have a vitamin D deficiency. Folks in the Caribbean often do when they come to the States. And when they come to France. So I was like, that was a very direct way of addressing the fact that, yes, this is my lineage, this is my genetic makeup, my DNA. And he was right. We tested for the vitamin D, and I was very, very deficient to the point where I was probably more comatose more times than I thought. But his approach was a little bit different. Like he didn't say you Caribbean people are all the same. You know what I mean? He was just like, I'm looking at your family history and I'm thinking that this could be part of the culprit.
Yeah, I love
You know,
that. Let me ask you one more thing before we go. Quickly, why do you think Americans don't get it? Why do you think we don't want this?
I think, I think nationalizing health insurance for America is basically becoming a socialist country. And socialism is considered left, and anything left leaning is a problem in the United States. There's no understanding that socialism is a shared responsibility for a nation's citizens, that we all pay into a pot that is distributed
That's how we have
for,
roads. That's why we have roads. That's why
yeah,
we have fire departments, right?
yes. I mean, yeah, or
That's why
maybe,
we
I mean,
that's why we have a navy. Like that's all the same thing.
yeah, I mean,
Yeah.
these are all shared experiences now and shared expenses. As a community, we need to take care of each other. And that is really the crux of socialism, is that everyone is contributing so that everyone gets taken care of, right? And so I see that working here. I don't see that I mean, we pay taxes for that. I really despise when people say, oh, you're living in France and you have free healthcare. Let's get one thing straight. My healthcare is not free. I pay a lot of taxes for that, but I see the return. Okay, so whenever I look at my net pay in this country, I never complain because I know exactly where it's going. I don't pay anything for my prescriptions, and I take, medication daily. I pay zero at the pharmacy because I am covered, but I pay taxes for that. I pay taxes in the United States. I don't get free health care for that. I don't know
Right.
what I thank you. I mean, ridiculous. And I get to travel, which I just did after spending 2 weeks in the States, on horrible roads that have been years since they've been repaired. So obviously, all the taxes that I pay in the United States are not going towards even the very minimal of things, transportation. God forbid we should allot some of that money, allocate some of that money for healthcare.
You're
No. Why
you're
would
talking
we?
like a radical. I love it. Yeah, it's
Here I am.
radical ideas, right? Like what if our taxes
You,
actually gave us something, some benefit for it? It would be amazing. Rose, I want to thank you so much for being so open and transparent and real about what is going on and what your own personal experience has been. It's a lot to be vulnerable about our care and about our most intimate of healthcare. Thank you so much. I just love seeing your beautiful face and talking to you, my
well, it's
friends.
great.
All
Yeah,
right.
same here.
All
Always
right.
a pleasure.
All right. We'll do this again, I hope, because there's more I want to ask you about. All right. Merci beaucoup, ma chère. À la prochaine.
De rien. Au revoir.
Au revoir.